Good afternoon. My name is Prince Agarwal and I am a student of first semester in Department of Social Work, Rajiv Gandhi National Institute of Youth Development. I am going to give the presentation on the topic Relevance of Cognitive Behavior Model in Social Work Practice under the supervision of Dr. Ram Babu Bocha Sir, Assistant Professor, Department of Social Work, RJ Anawadi. So, I am beginning with the topic Relevance of Cognitive Behavior Model in Social Work Practice. The cognitive behavioral theory is a brief psychological treatment focused on improving mood by changing thoughts and feelings. Numerous clinical trials and research studies have been conducted on the main components of cognitive behavioral therapy. In study after study, CBT is shown to be the most effective treatment for most psychological problems. Cognitive behavioral therapy works from the most current scientific understanding of psychology and related processes. It relies on a model of understanding psychological problems as the result of an interplay between thought patterns, emotions, and behaviors. As each component affects the other, often resulting in chain reaction of worsening symptoms over time. CBT targets each of the three components with the expectations that the entire system will change. Switching from ineffective thinking patterns to more effective thinking patterns will in turn result in more adaptive behavior and fewer emotional problems. Similarly, by modifying ineffective behavior, both thoughts and emotions are positively affected. Cognitive behavioral therapy targets each of the components and results in a short circuiting of the system responsible for negative mood states and problematic behavior. There are three main components of cognitive behavioral therapy: cognitive therapy, behavioral therapy, and mindfulness based therapies. Cognitive therapy focused mainly on thought patterns are responsible for negative emotional and behavioral patterns. From the perspective of cognitive therapy, negative emotional states are caused and maintained by ineffective or exaggerated biases in thinking. The key intervention in cognitive therapy is identifying distorted or self defeating patterns and learning to respond to them with more balanced, reality based thinking. This then results in fewer emotional problems and more successful behavioral patterns. This process is known as cognitive restructuring. Now, coming to behavioral therapy, it focuses more on the behavior as the more influential component of problematic psychological patterns. In behavioral therapy, problems are analyzed and problematic behaviors are identified. The main mechanism of change in behavioral therapy is facilitating the learning and implementation of effective behaviors to replace ineffective behaviors. This can take the form of modeling or teaching new behaviors, increasing exposure to previously avoided stimuli, and increasing rewarding behavior. Some treatments rely more heavily on cognitive interventions while others primarily on behavioral. However, treatments for more psychological difficulties rely on a combination of both cognitive and behavioral interventions to achieve long lasting change. Now, coming to mindfulness based therapies, it is the newest addition to cognitive behavioral therapy. Mindfulness is a meditation technique found in Theravada Buddhism that directs attention to the task at hand in a focused, non judgmental fashion. Although in some ways it is a cognitive intervention, mindfulness differs from traditional cognitive therapy in that mindfulness emphasizes sustained attention on the present, whereas traditional cognitive therapy relies on Socratic questioning or assumptions about the past, present, and future. During early sessions of cognitive behavioral therapy, problems are discussed and treatment goals are agreed upon. Based on the treatment goals and conceptualization of problem, each session is devoted to problem solving current difficulties. Unlike most forms of psychotherapy, between session homework assignments are assigned as a way of helping the client implementation the solution in his or her life. There is a significant research showing the use of homework in treatment is one of the most powerful indications of success in therapy. By rehearsing solutions to problems throughout the week, the client gains mastery in the skills needed to solve his or her own problems. In this way, the client learns to become his or her own best resource when future difficulties arise. CBT tends to take an educational and collaborative approach to engagement. The therapist's role tends to emphasize listening, teaching, demonstration, and encouragement. Treatment tends to be relatively brief and problem or solution focused. Social workers and practitioners from allied disciplines use CBTs to address a wide range of psychological problems. CBTs have a strong record of empirical testing and support and have been found to be applicable in a variety of settings from private practice offices to residential or long term care facilities to community based social services. That is all about my presentation. Thank you so much.